Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Staphylococcus aureus. Staphylococcus aureus has asymptomatic carriage in the nasal pharynx in up to a third of the population. This can cause severe disease, especially in patients with immunosuppression and diabetes. Staphylococcus aureus can look like a bundle of golden grapes under the microscope, which appear violet. And this is because they are gram-positive cocci, and the bundle of golden grapes is in fact where its name is derived from. They are aerobic bacteria, and they are also catalase positive and coagulase positive. Staphylococcus aureus may seed to distant sites, including bone and joints, the heart valves, and prosthetic materials. You'll remember this slide from our previous videos on gram staining and classification of bacteria, but just in case you've forgotten about the classification of bacteria, you can always look at our previous episodes, and the links are just on the screen right now for you to click on. Staph aureus is associated with multiple types of diseases, including skin infections, such as cellulitis and impetigo, abscesses, septic arthritis, of which it is the most common cause, and also osteomyelitis. Other associated diseases include endocarditis, especially in intravenous drug users, which can lead to a tricuspid valve infective endocarditis, pneumonia, such as post-viral as a superadded infection causing patchy consolidation, toxic shock syndrome, scalded skin syndrome, and food poisoning, especially from meat and cream-based foods without adequate refrigeration. The management of Staphylococcus aureus infections usually is with penicillins, usually flucloxacillin. High-dose intravenous flucloxacillin for long-term use may be needed in cases of septic arthritis, osteomyelitis, and endocarditis, so the really severe infections. Surgery may be needed for deep-seated abscesses or prosthetic materials. So let's now try a question. A 55-year-old man with diabetes mellitus presents to the clinic with a 2-week history of pain and swelling in his left foot. He has a history of poorly controlled blood glucose levels and peripheral neuropathy. On examination, there is erythema, warmth, and tenderness over the metatarsal area. Radiographs of the foot reveal bone erosion and periosteal reaction, consistent with osteomyelitis. Blood cultures are drawn, and the results identify Staphylococcus aureus as the causative agent. Which of the following is the most likely route of infection in this patient? So these are your options. Hematogenous spread, direct inoculation, contiguous spread from a nearby soft tissue infection, spread from a distant cutaneous source, or translocation from the gastrointestinal tract. So you might wish to pause the video at this point and look back at the vignette, just to remind yourself of the history. But as we've been told, this gentleman does have a history of poorly controlled diabetes and peripheral neuropathy, and he's also got an area of erythema and warmth over the metatarsal area. So this makes it most likely that the osteomyelitis has come from contiguous spread from a nearby soft tissue infection, and so the correct answer in this case is C. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.